What does it mean to be abnormal? Is it just being different from everyone else? Let's talk about mental health and how we understand what's going on inside our minds. Defining abnormality isn't as simple as it sounds. One way is the statistical approach. Imagine we measure anxiety levels in the population. Most people fall somewhere in the middle. If your score is way higher or even way lower than the average, you're statistically unusual. But does that mean you have a disorder? Not necessarily. Many people with high anxiety live happy, functional lives. So, for a behavior to be considered clinically abnormal, it usually needs to be rare, but also harmful or undesirable. Another angle is social deviance behavior that goes against society's rules. But this gets tricky because norms change from culture to culture. For example, in some cultures, burning valuable blankets is a traditional ceremony to shame a rival. In Western society, if you burned your most valuable possession, people might think you need help. So, while social norms are relevant, they can't be the only measure. To make sense of all this, professionals use classification systems like the DSM-5 and the ICD-10. Think of them as guidebooks that group symptoms into specific disorders. The DSM-5, for example, lists over 200 mental disorders. These systems help create a common language for diagnosis, but they're not perfect. A big challenge is reliability versus validity. Reliability means that different psychologists looking at the same patient should arrive at the same diagnosis. Validity means, does the diagnosis actually measure what it claims to measure? It's easier to make a system reliable than it is to make it valid. Plus, there's the issue of comorbidity, where one person fits the criteria for multiple disorders, which blurs the lines between categories. Let's look at a specific condition, schizophrenia. The name comes from Greek words meaning split mind, but it's not about having multiple personalities. It's a complex condition affecting a person's thoughts, emotions, and connection to reality. Symptoms are often split into positive things that are added, like hallucinations or delusions, and negative things that are lost, like motivation or emotional expression. For instance, someone might hear voices that aren't there or believe that random events have a secret personal meaning. So, what causes it? Genetics definitely play a big role. Twin studies are very telling. If one identical twin has schizophrenia, the other has about a 48% chance of developing it too. For non-identical twins, that rate drops to 17%. The risk in the general population is only 1%. This clearly shows a strong genetic link, but genes aren't the whole story. If they were, the rate for identical twins would be 100%. This is where the environment comes in. Factors even before birth can have an impact. High levels of stress or infections like the flu during a mother's pregnancy have been linked to a higher risk for the child. It seems these events can affect the baby's developing brain. The family environment after birth also matters. A stressful, critical, or overly involved family dynamic doesn't cause schizophrenia, but it can increase the chances of relapse for someone who already has the condition. It's also crucial to remember cultural bias. What's considered a symptom in one culture might be seen differently in another. Diagnosis rates can be skewed if a therapist doesn't understand a patient's cultural background. In the end, it's not a simple question of nature versus nurture. Schizophrenia is best understood as a complex interaction between genetic vulnerability and environmental factors throughout a person's life. It's this combination that shapes who is at risk and how the condition develops. Understanding these complexities is the first step toward better support and treatment for everyone. Thanks for watching, and if you found this helpful, be sure to subscribe for more insights into the human mind.